A good day. So our topic for today will be about the gross examination of the tissue. So before the actual gross examination of the tissue, we have the process called accessioning. When we say accessioning, it involves the uh, steps in receiving the specimen into the laboratory, most especially in the histopath section. So in accessioning, very important that the medtech, or the person assigned there is knowledgeable with the different samples that the laboratory may receive. No? So meaning into that person nakasalalay, no? Yung adequacy ng specimen. Is the specimen enough for the laboratory procedure? No? And also yung tinatawag na acceptability of the specimen. Baka naman yung specimen ay wrong specimen, no? O kaya naman ay nabubulok na. So meaning, after extraction from the body of the patient, hindi siya na-preserve. No? So those are the things that must be checked, no, in the accessioning procedure. Now let's go with the examination of the tissue. So basically, there are two types of examination of tissue in the histopath. No? So number one, we have what we call the microscopic examination. So of course, when we say microscopic examination, this involves the use of a microscope, no, in able for you to evaluate, no, to determine the presence of disease into the specimen, no. And the other one is what we call macroscopic examination. So pag sinabi natin macroscopic examination, this involves the examination of specimen with our bare eye, no, with our naked eye. So meaning you will not be using a special device, no, to examine the specimen. Can we really detect abnormality into the tissue by just looking at it, no, with the use of our bare eye? Yes, no. Like for example, kung merong abnormal discoloration dyan, if there are no abnormal structure, no, that appeared into the tissue, so those are the clues that there must be something wrong with the specimen. When we say gross examination, it is the process by which the pathology or pathology specimens are inspected with the bare eye to obtain diagnostic information while being processed for further microscopic examination. So most of the time, after the gross examination, no, it will be followed by a microscopic examination. No? Kumbaga, the findings in gross examination will be supported by microscopic examination or even validated in microscopic examination. It is typically performed by a pathologist or by a pathologist assistant working within a pathology practice. In gross examination, the first step in specimen processing is identification. So you need to identify what type of specimen you receive, no, and all its components. Aside from the main organ, so you also have to determine what are the other structures attached to it, no? Like for example, if you receive a uterus, is that really only a uterus? So it can have other small organs attached to it or other tissues, no? Like for example, so pwedeng nandun pa yung fallopian tubes, the ovaries, the cervix, or even the vaginal canal. No, meron pa ring part doon. So you need to take note of that also, no? And we have what we call bilateral organs, no? Pag sinabi natin mga bilateral organs, meron siyang left and right part, kumbaga. Like for example, the kidneys. You have your right and left kidney. So you have to note that, no? Extremities, our hands and feet. So there is left and right, no? Our eyes, ano pa ba? Lungs, Mga bilateral organs po yan. So you need to indicate that into your worksheets. There are usually two end products of cross-examination of surgical specimen. Number one, the gross description of the specimen. No? The manner you describe the specimen. No? That's your gross description. Number two is the set of tissue blocks. No? O meaning, from the specimen that you receive, so you will get a representative sample from that will be subjected to microscopic examination. These are the specimen that we may receive in a histopath section. This one is actually a kidney, no? But is it really only a kidney? No? So if you will observe it. So there is actually an abnormal growth of tissues here. No? So that is actually a tumor. No? So it is not only an ordinary kidney. And again, kidney is a bilateral organ. So you need to indicate if that's the left or right organ. No? This one is a uterus. This is a uterus. Ayan. So attached to it is the fallopian tubes. Also have its ovaries, the cervix, and even a part of the vaginal canal. No? So I have to indicate that. What else? This is a brain tissue. Now, part of the accessioning, no, is making sure that the specimen is adequate. No? Sapat ba yung na-receive mong specimen? Baka naman incomplete, no? Not enough for the lab procedure, no? Is it acceptable? No? Is it placed in a proper container? No? Is there any label? Is there a label to the specimen? So those things are the things that we need to check, no? In our specimen. The following are the criteria for rejection of gross specimens. Number one, discrepancies between the requisition and specimen labels. Like for example, the name. No? The name in the requisition form and the container is different. No? O kaya naman, the specimen in the requisition form is different from the specimen received. So for example, in the requisition form, left kidney. But with the sample, it's right kidney. So, very different. Specimen with no labels or mislabeled specimens. No? Different name in the requisition form, different name in the container. Leaking specimen containers. Absent clinical data or history. Because this information is very important. Because it will be used by the pathologists, no? As a clue. Kung ano yung pwedeng disease na present into the specimen. No? So para meron siyang hint kung ano yung dapat niya hanapin. Next is inappropriately identified specimens. Materials used for gross examination. So we have the standard dissecting sets. So example of it, no? Or under it we have scissors, forceps, and also the blade holders and the plate. We also have what we call gross lab or gross table or gross station. So basically, this is where we perform the gross examination. It is a specialized workstation designed for pathological and histological dissection of specimens and organ. What are the components of this gross table, gross station, gross lab? E-sink, where you can, like for example, wash the specimen. Stable tabletop. Sometimes it involves cutting of hard specimens. Water supply, irrigation system, fume extraction system or ventilation system. Most especially for the chemicals, no, which have vapor. No? Like for example, into the formalin. Medyo mabaho yung formalin. Lalong-lalo na kung yung ano niya, yung amoy niya na nananatili dun sa laboratory, no? Waste disposal unit. And for some other gross stable, uh, may include formalin dispensing unit. So, meaning there is like a hose, no, for dispensing the formalin for preservation of specimen. Formalin neutralizing filter, hands-free foot pedal for hot and cold water, magnetic instrument bar, a dictation system, or like for example, while you are describing the specimen, no? So, pwedeng may tatapakan ka, pag tinapakan mo yun, magre-record kung ano yung sinasabi mo na re-record niya. Then after the procedure, so you can write, no, you can encode, no, your descriptions. And a magnifying lens as well as a task lamp. This is an example of the gross table, no, or the gross station, grossing station. In this type of grossing station, so mas ano siya, no, mas advanced siya. Meron siyang camera, may monitor siya, no? Ayan, meron siyang ventilation system, no? Fume extraction system. Ayan, meron din siyang portal for water, etc. Napakaganda ng kanyang crossing table. Again, for the first end product in crossing is the description of the specimen, describing the specimen. All anatomic structures must be identified and verified. No? So again, if the organ is uterus, is that really only a uterus? It may include some of the tissues or organ, no, near to it. So you also have to include them. Some surgeon include a diagram in the requisition form. So minsan ang ginagawa ng mga surgeon, for example, sa requisition form, i-drawing nila yung organ. No? And then lalagyan nila ng markings kung saan nila gusto mo or kung saan nila gusto magpakuha ng sample. No? So i-drawing nila doon para alam ng pathologist, gusto niya malapit sa cervix. No? So therefore, the pathologist will collect sample, no, from the cervix. For easier identification of specimen part, they may also use orientation marker such as inks, nicking, or suturing into the actual specimen para aware yung pathologist, no, kung saan siya pinapakuha ng sample. For describing the specimen, these are the parameters, no, that we will follow. Number 1, the weight of the specimen. It is rounded to the nearest 0.1 grams. Okay? So of course, for this parameter, so you need to use a weighing apparatus. No? Dimension, it is rounded to the nearest 1.0 cm. No? So that includes the height, the length, the width of the specimen. No? Color, you need to be specific with the color. No? If that is red, what kind of red? If that is white, what kind of white? No? Like for example, for the red, baka dark red yan. Light red. Yung mga ganon. So, be specific. No? Consistency. So, of course, for you to know the consistency of the specimen, you need to touch it. No? Because sometimes, the students is, nandidiri sila sa specimen. So, hindi po pwede. So, how will you know the consistency? No? So, under the consistency, so pwede siyang firm, soft, hard, or pwede rin meron siyang rough structure, no? Depending on the specimen. Shape, is that round, oval, or the specimen have an irregular shape, no? Structure included, again, so if that is a uterus, is there's the presence of the fallopian tubes, ovaries, cervix, etc. No? So you have to include them. So again, these are the parameters in describing the specimen. So this will serve as our guide in describing the specimen. Okay? Specimens for gross description only. Examples are accessory digits, bunion or hammer toes, extraocular muscle for corrective surgical procedures, inguinal hernia sufferers in adults, nasal bone cartilage from rhinoplasty, prosthetic breast implants, prosthetic cardiac valves without attached tissue, tonsils and adenoids from children, torn meniscus and umbilical hernia sacs in children, as well as varicose vein. The second end product is a tissue section, no? A representative sample. Judicious representative histologic sections are taken. No? So for example, if this is the size of your tissue, of your specimen, no? What you will do is only to get a representative sample from that. No? Na siya mong ipaprocess at gagawan ng slide. No? Hindi pwede yung buong specimen na yan, i-chop mo ng maliit, and then lahat gagawan mo ng slides. Napakadami nun. No? So we only have to choose a representative sample from the specimen that we receive. No? And in choosing the representative sample, we must choose the most abnormal part. No? Yung pinaka-abnormal ang kukunin natin. Kasi ina-assume natin na doon sa abnormal part na yon, nandoon ang disease. No? Nandoon yung abnormality. Okay? All hollow structures are open as part of the initial examination, just like with the uterus. So the uterus have an inner part, no? So in able for you to describe, no, to examine the internal structure of the uterus, so you need to cut it. Meron tayong tinatawag na bivalve technique, wherein you cut paano ba to? Vertically, no, the uterus into two. Same manner on cutting the avocado. So paano yung po ba kinakat yung avocado? Diba? So ganyan pataas, no? Just like with this picture. Ayan, kinat na ganyan. So that is actually the bivalve technique, no? So that is used for the uterus. Okay? For specimen with tumors, the following must be identified. Site and size of the tumor. You also have to note that. Location and structures invaded by the tumor. Vascular invasion. Distance from section margin. And presence of lymph nodes. So basically, all of this is related to the condition called metastasis. No? Yung pagkalat ng cancer cells. So the representative sample must be put into what we call tissue cassette. No? Dito natin siya ilalagay. Yung tissue cassette na yan, ilalagay mo dyan sa loob yung specimen mo. Then makikita mo yung tissue cassette, maraming mga holes, may mga butas-butas siya. Kasi yung mismong tissue cassette, ang siya mong ibababad sa mga reagents na gagamitin mo in tissue processing. Okay? Measures 3 by 2.5 by 0.4 cm. Processing of specific specimens, the lymph node. It is most important component of all the tumor resection. Okay? It should be received fresh and not immersed in formalin. So what you can do for lymph nodes, especially for urgent biopsy, no? You can put it in a gauze pad, moisten or wet with saline, no? The specimen size, color, consistency should be reported as well as the visible nodularity, hemorrhage, or necrosis. For dermatologic specimens, a vertical orientation of the specimen should be maintained at all times since the objective is to visualize the entire epidermis in perpendicular section. It is described in terms of color, dimension, size of the tumor, ulceration, hemorrhage, depth of invasion from the skin surface, and also involvement of the margins. For colon cancer, specimen come in the form of small biopsies from colonoscopy or resection specimens. For polyps, the base should always be ink because that is very important, no? Sa tinatawag natin invasiveness. For large polyps, it is trimmed away from the stalk. So the processing of specimen, no, varies, with the type of specimen that you have. For breast cancer, all data that are important for determining prognosis should be described, including tumor location and size, skin or nipple involvement, marginal and nodular and nodal status. The gross characteristic of tumors such as shape, consistency, and appearance of the cut surface should be described. For mastectomy specimen, that's the breast, no? The weight, total size of the breast, size of the axillary dissection, skin ellipse, nipple, scar, basal margins are adequately described and sampled. Next is the lung cancer, tumor size, lymph node involvement, and the pleura. Basically, the lymph node is very important, no? Kasi ginagamit yan, no? Yung pinaka-lymph vessel natin by the cancerous cells to metastasize. So pag ang pathologist nagpo-perform ng Grossi, isa sa mga hinahanap niya yung lymph node. Kukuha siya ng sample niya. Kasi kung ang cancerous cell nasa lymph node, so it is a sign of metastasis, meaning kumakalat na siya. Even to the pleural fluid, pag nandun ang cancerous cells, it's a sign of metastasis. Presence of tumor at the section margin, multipocality of tumor should be recorded. Prostate cancer, prostatic cancer cannot be readily distinguished grossly. So it is important to sample multiple sites at each lobe. So basically, the description of the specimen, the number of section, the number of representative sample that we took from the specimen are all noted into the what we call specimen worksheets. No? A specimen worksheet or a gross worksheet contains the accession number, the number of sections and blocks taken per case. No? It is primarily guides the statistician in assuring that all blocks are processed. Okay, so like for example, in this paper, you write there that you prepare, you get 10 sections, no? O kailangan yung histotechnician, 10 rin yung mabibilang, no? Para that is to assure, no, that all of these specimens will be processed. Extra information. The initial step in any examination of clinical specimen is confirmation of the identity of the patient. Or you check the requisition form. It is the same with the name written into the specimen container and the anatomical site from which the specimen was obtained. No? Saan ba galing yung specimen na yun? No? So again, if that is a bilateral organ, so it needs to be indicated there. No, if that is the left or the right organ. When a malignancy is suspected, then the specimen is often covered with ink in order to mark the margins of the specimen. So if the surgeon thinks that the normal cells is in that location into the specimen, then lalagyan niya ng markings yan. Isusuture niya, no? Lalagyan niya ng mga ganyan, ink, no? Para palatandaan na si pathologists doon kumuha ng sample. Since only a minority of the tissue from enlarged specimens can reasonably be subject to microscopic examination. Kasi hindi naman yung buong specimen na ganyan, gagawin mo ng slides. The success of final histological diagnosis is highly dependent on the skill of the professional performing the gross examination. If the person performing the gross examination is not really that good, so the chances are that person will miss, no, the important part of the specimen. So pwedeng hindi niya makuha yung pinaka part ng specimen na nandoon yung abnormal tissues or cells. No? Kaya very important ang crossing. Other types of ancillary tests includes microbiological culture, flow cytometry, cytogenetics, and even with the use of the electron microscope. So related to it, so we have a video. So let me show it also. So this is a cross-examination of a gallbladder. No?
Here is gallbladder. First, we're going to talk about whether it's received intact or.
So please take note of the parameters that we will use for describing the specimen.
In length.
Number one is the dimension.
Open it and measure its circumference. And then we're going to talk like with any organ, describe from the outside to the inside.
Describing from the outside into inside.
Surface, and we'll just say that it's tan, pink,
color,
and glistening,
consistency. So you have to take note of that.
This side is the hepatic bed, so this is where the gallbladder
structure included.
And normally I just say something like there's a roughened hepatic bed with cautery artifact.
So that's why very important that the one performing the gross examination is very knowledgeable to the different tissues in our body.
Has staples. This is the artery, and this is the cystic duct. So I just make a comment. I pull out the staple and say the cystic duct measures 0.2 cm at the margin of incision. That's it for the outside of the gallbladder. So now I'm going to just start dictating it, and I'll cut it open, and then we'll continue with the inside. Specimen A, received in formula labeled gallbladder, is an intact gallbladder.
So while the doctor is examining the specimen, actually naka-record na siya. Nire-record niya yung sarili. So that after that, he can review that and transcribe, no? What he said while performing the gross examination. So if there is an abnormal structure found into the specimen, so I also have to indicate that and also inspect it.
Uh, 6.0 cm in circumference, close parentheses, period. The serosa is tan pink, smooth and glistening. There's a rough hepatic bed with
color, consistency.
0.2 cm the marginal incision, period. So now talk about the inside. So you'll see that the mucosa is kind of like tan brown or red brown.
Yeah. So if there is an abnormal color, so we have to note that. Like for example here, so that's the sign now of cholesterolosis.
And so we're just going to describe it as diffuse yellow streaks. And also there's a stone in here. So
there's a gallstone.
Something about mucosa is red brown and has diffuse yellow streaks. And then we'll say the wall thickness measures up to 0.3 cm. And then we'll talk about the stone. The mucosa is red brown with diffuse yellow streaks, and the wall thickness measures up to 0.3 cm, period. Within the container is a ovoid.
It's actually the tissue cassette.
Calculus, 2.0 cm in greatest dimension. Close parent period. Cut surface of the calculus is crystalline with a central dark brown core, period. Representative sections are submitted in cassette A1.
So even yung abnormal structure described, no?
Since there are 3 areas anatomically of the
now
gallbladder,
is about to get a representative sample from the organ.
And so we want to sample, we don't want to
again, in
sample
choosing
all
it,
the same area.
you must choose the most abnormal part.
Samples of the body. We want to sample.
So in this case, his basis is the presence of cholesterolosis.
And since there's this cholesterolosis everywhere, it doesn't matter where I sample from, I'm going to demonstrate that. But if there's only cholesterolosis in one area, then you're going to want to sample that area. So here's from the body, and here's big one from the neck. microscopically, you won't be able to tell if it's from the neck, body, or fundus. But this is just a way to sample it, a good sampling of the specimen.
Okay.
Now, this mucosa is really not based. Sometimes when there's stones in here, the stones rub on the mucosa, it kind of denudes the mucosa. And that's common when there's a lot of stones. So that's something that we comment on if there is. And usually
So ito yung dissecting
mucosa
set niya, no? Forceps,
will be faced and
uh,
it'll be just rough and
scissor, the knife,
Space.
the
I don't really
blade.
see that. That's pretty much it for gallbladder.
Okay, so that's it. So let me stop the recording.